So I'm Ayorinde James, a research fellow here at the Nigerian Institute of Medical Research. So my core research interests are actually molecular oncology, and I learned virology by apprenticeship from one of the foremost virologists in the country, who is Professor S.A. Omilabu. And within for many years, we've worked on several projects like Lassa fever virus. For many years, we did the sequencing, even before sequencing became popular. Then we also worked on the first sample of the Ebola virus in his lab in those days. And coming to NIMR, I've been privileged and opportunity, and with the great support of the NIMR working environment, to work more on sequencing of SARS-CoV-2 in collaboration with quite a number of wonderful and interesting colleagues, such as Dr. Chikanwama Joseph, Shaibu, and Dr. Walukun, and also support from Professor Aldo. The NIMR environment has made it very easy for us to achieve what we thought we could not achieve in many research space in this country. However, we're still faced with the challenge of having to make primers and get and primers are just oligonucleotides, which are short DNA sequence. And this short DNA sequence have been very instrumental in all of the projects that we have been doing, with the sequencing of the viruses, and even in oncology. And many times we have to rely on importation of these primers from abroad, which takes quite a number of time. And because we have the skill set in designing these primers, we usually would have wanted to design, and by next morning you have your primers in your lab and you can test. And so that if there is an issue, you can iterate the process and request for another primer same day and continue your work. But we discovered that we couldn't achieve this because we had to order for the primer and find a way to get dollars to make payments before they start the synthesis. And at the end of the day, you're spending close to 2 weeks to wait for your set of primers to come. And at times, we'll have to wait for several people that want to order for primers, so that we could all collectively order and bring in all the primers at the same time, and that could take us about a month or two. And this caught the attention of the DG, Professor B.L. Salakon, and while we were talking, we didn't know the DG was listening, and he said, "This thing that you call primer synthesis machine, can we get it in the country?" And we said yes. And so we quickly got some information and presented it to him, thinking that he would forget about it. But he called us himself and said, "This thing must happen in NIMR, and we must have it, so that you guys don't have to be waiting for several days to have the primers to be synthesized." Interestingly, another wonderful senior colleague of mine, Dr. Greg Ohaimo, had to talk to some friends in MTN, and we were asked to write a proposal, and we started a meeting with MTN, and we submitted a proposal. Dr. Greg followed up with some of his friends over there. So at the end of the day, MTN said, "We are going to buy this, and we are very much interested in having the oligosynthesizer," and hence we have the oligosynthesizer today in NIMR. So I believe with this machine is that people won't have to be going, waiting for many months before they can get their primers to do their research. I believe is that when there is an outbreak, NIMR can respond like the way we did during the SARS-CoV-2 outbreak, whereby NIMR had to develop a lot of kits to support the outbreak. So this will further help us to respond in case there is a new outbreak aside from SARS-CoV-2 comes up. Can we get primers around the country? because if we can get it around the country, it means testing, rapid testing can be done in different parts of the country, and disease management can be brought to bear quickly. And so this is not just for Nimr, it's for the whole country. We hope that we'll be able to extend our arms to some parts of West Africa, because I remember when I used to work on Lassa, we were the ones that was doing detection for Benin Republic. So Benin Republic will have to bring in their samples to Lagos, and we'll have to analyze the samples and send the results to their minister or to their Ministry of Health. However, Benin Republic now can run PCR, but they don't have an oligosynthesizer. So if there is an outbreak, Nimr could make the primers or the oligos for them, deploy the oligos to Benin, and Benin too can do their disease surveillance. So this in turn will help the whole of West Africa, and by so doing we can improve on some of the things that we are doing in terms of research and healthcare, and finally have effective patient care in our society. Thank you.